Let's talk about coccyx pain or tailbone pain when the patient has been told that all of their imaging studies were reportedly normal. I'm Dr. Patrick Foy, the director of the Coccyx Pain Center or Tailbone Pain Center here at Rutgers, New Jersey Medical School. And lots of patients travel in to see us from around the country, around the world, and they've been told that their previous imaging studies were totally normal, but the person still has lots of pain at their coccyx or tailbone. Let's talk about several reasons why that could happen. Number one, very common, is that the imaging studies never even included the coccyx at all. Most commonly, they were of the lumbar or lumbosacral spine and did not go low enough to see the coccyx in the imaging studies. That's reason number one. Number two is that if it was an MRI or a CT scan, often it failed to include a sagittal view, which is a view that goes right down the midline. Or number three, if it did include a sagittal view, on the MRI, they might not have included the T1 and T2 sort of filter settings, which show the bony structures and any inflammation, respectively. And number four, on the MRI, if they did a sagittal view, they might not have done thin enough sections. So the tailbone at the midline is very thin. So if they do one slice at one side and the next slice is thick and it's at the other side, one to the right and one to the left, they may miss the coccyx or most of the coccyx entirely. Number five is that if it's on X-rays, they might not have done a lateral view, which is a side view, which is the view that is best at showing problems and pathology at the coccyx. Number six, the X-rays might not have included a coned down view, which is almost like a zoom lens that focuses in specifically on the tailbone. Number seven is that the X-rays might not have included sitting versus standing views. With coccyx pain, sitting is typically the most painful position, so it makes sense to do the X-rays while the person is sitting and compare that with while the person is standing to see if there is hypermobility while sitting, which is the number one most common cause of tailbone pain. Number eight is that even if it included the coccyx on the imaging studies, it's very common that the radiologist fails to even comment on or mention the coccyx or tailbone in the report at all. Or number nine, the radiologist looks at the coccyx but just is not familiar with the common causes of tailbone pain because tailbone pain is relatively uncommon as compared to low back pain in the lumbar spine. And then number 10 is that the treating physician maybe never looks at the actual imaging studies himself or herself, and therefore they can't put the clinical context of, for example, the patient is feeling this bony tenderness at the lower tip of the tailbone, and to be able to take a look at that specific area to see if there's a bone spur or a fracture or something else that may be causing the pain there. Or number 11, the physician looks at the tailbone but just doesn't know enough about the causes of coccyx pain to really be able to accurately assess the imaging studies. Again, just because tailbone pain is uncommon compared to low back pain, for example. So just like if I was to look at an MRI of the brain, it would not be surprising if I was to miss something there just because that's not a common part of my own practice. So again, there's 11 different reasons why people can have tailbone pain and be suffering with tailbone pain, coccyx pain, and be told that their imaging studies are totally normal. For more information about tailbone pain, you can get my book on Amazon, Tailbone Pain Relief Now, or to come and see me in person or find more information on my website, just go to tailbonedoctor.com. I hope that's helpful. All right, bye-bye.